Welcome to the Keele Active Virtual Environment, or KAVE, a new installation we've put at the university to help us provide standardised access to clinical scenarios with screens either side of me here and to the rear and the floor, all of which having computer projections on them which can simulate a number of environments. What we're going to do is show you how we use this for everything from molecular modelling right the way through to dealing with patients in a simulated hospital ward. If I now put on the three-dimensional glasses, this allows me to enter the 3D environment. The glasses also have a special motion sensor, so as you see when I turn around and start walking towards the molecule, I'm entering its environment. As well as that, in my hand here, I have a separate wand which I can use to manipulate the molecule. I can turn it around from side to side. It's a stunning way of bringing molecular chemistry alive. The next stage is to think about the body. So here we have our virtual body, and what I can do now is start taking this apart, and as I take it apart I can see the labels on things as they come off. If you start by taking the skin off, we're immediately down to the nerves and circulatory system. We remove those and we keep going until we go right the way back to the skeleton. Really brings it to life for students, and of course the great advantage of this is you can have 20 or 30 students experience this at the same time, all sat in the room looking at the cave with 3D glasses on, either watching you do a virtual dissection or taking it in turns to do it for themselves, doing it as individual work or small group work. In this case we've got input here for an MRI scan, and this has got great potential for simulating either operations or for doing research. If you can see here now, rather than just getting the individual slices for an MRI scan, we can take the complete thing and then slice it down while we're looking at it, taking sections out a piece at a time. So here we are again, back in the virtual ward. As you can see, and here, we've recreated as naturally as possible the ward environment. I can move forwards or back to this patient, have a look at the vital signs, pick up the drug chart, have a good look at it. Of course, what you're seeing now, which is the image stretching and move around, my world is perfectly three-dimensional and proportional now. It really does recreate the environment of the ward as I move from this patient here, say, to this lady over here on the left.